I recently criticized the 2023 European Society Hypertension Guidelines for the management of hypertension for its definition of hypertension. The definition lacks the individuality of the human because it attempts to categorize everyone under the same criteria, 140 per 90, with a few exceptions, 160 per 90 for elderly individuals aged 80 and above. There is no such thing as hypertension in this definition, since it cannot be diagnosed without evaluating a person's overall health condition. A doctor deals with patient, not just a disease they have. High blood pressure is simply high blood pressure, which is not always associated with hypertension. I hope that if you watch this my video, you will agree with my agreements. Now I want to focus on what the 2023 guidelines for the management of hypertension mention and what they fail to mention, especially regarding the optimal blood pressure. The creators of the 2023 guidelines for the management of hypertension have got it all wrong. They claim that cardiovascular risk starts to increase when the blood pressure goes beyond 115 per 75. That's not necessarily true. This risk exists at any blood pressure level. For example, if the blood pressure is 115 per 75 or lower, it is already considered arterial hypertension with its own set of cardiovascular risk. What is good for one person may be bad for another, and vice versa. Therefore, the conclusion that my former student and now colleague in science and medical practice from Ashkenol, Volodya Shlyakover, reached is that the best blood pressure is 0 per 0. In other words, either before a person is born or after they have passed away. But on a serious note, the Society of Hypertension and other societies stained by pharmaceutical and medical equipment manufacturers and sellers have started dealing with trivial matters. So, fellow medical colleagues, my advice is to take various guidelines into consideration, but prioritize the best interest of your patients above all else. Thanks for likes and sharing.